pimples, blackheads, whiteheads. Ooh, acne is a frustrating part of growing up for about 85% of teenagers.
There are plenty of myths out there about what causes acne and how to treat, especially when it comes to myths around food. So here to help us clear up some of the confusion, Dr. Gigi Chawla, the Chief of General Pediatrics at Children's Minnesota. Thank you so much for joining us right now.
Well, thanks for having me back.
Let's get to it. Break down the connection between food and acne. Are there certain foods we should not be eating that produce more acne in faces or whatnot?
Well, this is one of my favorite topics. I love talking with teens about acne in general. And really, there's not a ton of connection between the foods that you eat and acne in general, on a macro scale.
Yeah.
On an individual scale, there might be some foods that cause more inflammation in your body.
Okay.
And those are the foods to kind of think through. Things like dairy or chocolate or even fried foods might be some of the foods that cause more inflammation on an individual's body that could lead to acne and
or
outbreaks.
if you have acne, might make it worse.
Yeah,
there. Okay, so what is
right.
happening with teenagers? Because it seems like really the worst time for you to get acne, when you're just most self-conscious.
It is.
And what's going on?
It is the worst time. So if you think of every pore produces a little bit of that mucus, that sebum that is supposed to generally make your skin beautifully soft. That's its purpose, is to come out. And during puberty, the hormones that you make produce a lot more of that mucus, of that sebum. So really, the biggest issue that happens during teenage years is the sebum is trying to get out, and you're doing things to the top of the skin that aren't letting it come out. Like sweating.
Yeah.
Right? A lot of athletics happen during that time, and so sweat blocks it and the sebum gets stuck. Or you're not washing your skin twice a day to get some of the excess oils, dirt, makeup.
I'm glad you mentioned that. Like, for example, like when you mentioned cleaning your skin twice a day.
Twice a day.
You see the commercials for Noxzema pads or Oxy pads. Are those actually recommended to clean your face, or is it just water, or what should you use?
Really, the best thing is just water and a really, really gentle cleanser. You could do something like Neutrogena or, honestly, water alone, right?
Yeah.
But not anything super harsh to clean your skin twice a day, really mostly to get, again, anything that is going to block your pores, makeup, oil, excess oil, dirt, sweat off of there so that the natural process can happen.
So you're saying I don't need a skincare regimen?
You don't need a skincare regimen.
13.
In fact, honestly, a lot of those TikTok type skincare regimens do a lot of damage.
Right.
They're causing inflammation, they're causing irritation, which causes the pores to swell, and you can't get the natural sebum out. So it's the most you want to do the most gentle routine possible.
Okay, what if you just have a really bad case? Are there medications that kids can take?
Yes. So first of all, over-the-counter benzoyl peroxide, still the best thing out there for the first-line treatment. It treats both the bacteria that can get trapped in the pore and cause an infection, which really can look red and irritated. So benzoyl peroxide dries out the pore and also kills the bacteria. And after that, there's a lot of great products. So products that kind of help exfoliate, gently exfoliate the top layer of skin so that the pore stays open. That's really your best bet. And then there's lots of other additional treatments, but you want to talk to your doctor about that.
For sure. All right, as always, Dr. Gigi, great to talk with you.